Are you someone who is tired all the time and lacks that get up and go motivation? Have you noticed any recent weight gain? Do you feel like you can't keep yourself warm? You may be experiencing hypothyroidism, but there is something you can do about it. Synthroid, also known as levothyroxine, may be the drug for you. This drug works by replacing the T3 and T4 hormones in the body due to insufficient production by the thyroid gland. By simply taking the drug 1 to 2 hours before breakfast on an empty stomach each day, you may find yourself with increased growth in metabolism, see signs of weight loss, and have increased ability to regulate your body temperature properly. Lifelong replacement is necessary. Do not discontinue the medication without talking to your provider. Please call your doctor if you experience anxiety, tachycardia, chest pain, nervousness, tremors, palpitations, abdominal cramping, heat intolerance, fever, diaphoresis, or weight loss. Do not take this medication if you have thyrotoxicosis, adrenal insufficiency, or have recently had an MI. Call your doctor to find more information about levothyroxine today. Do you or someone you know have hypoparathyroidism? This condition is attributed to low calcium levels in the body due to a variety of possible factors including parathyroid or vitamin D deficiency and hypocalcemia. When these are present, the individual commonly experiences aching, cramping, or twitching of the muscles, fatigue, weakness, and tingling in the extremities. Can anything be done to help? Yes. Calcitriol, the parathyroid hormone replacement, may be right for you. This drug works by promoting calcium absorption from the GI tract and also promotes secretion of calcium from the bones into the blood. With increased calcium levels in the blood, the individual will see decreased muscle cramping and tetany. Remember to contact your doctor if you continue to experience muscle pain or show other side effects including abdominal cramping, bone pain, constipation, dehydration, dry mouth, drowsiness, behavior changes, headaches, changes in heart rate, nausea and vomiting, weight loss, or metallic tastes. Maintaining adequate levels of both calcium and vitamin D in the body are essential to a balanced parathyroid gland. With hormone replacement, you can say goodbye to all those achy and twitching muscles and get back to participating in those activities you love. Talk to your doctor if you think this choice is right for you. Have you recently noticed any weight loss or a decrease in appetite, extreme fatigue, darkening skin pigmentation? These are all manifestations of Addison's disease, or a hyposecretion of glucocorticoid hormones of the adrenal glands. If this sounds like something you have been experiencing, drug replacement with hydrocortisone may be right for you. This drug works by mimicking the effect of natural steroid hormone to correct abnormal levels. With hormone replacement, you can expect to see an increase in metabolism and a decrease in other symptoms. This drug should not be discontinued suddenly, and increased doses are needed during times of stress. Contact your doctor if you experience any adverse effects including tachycardia, hypertension, hyperglycemia, edema, increased appetite, weight gain, abnormal fat deposits, or peptic ulcers and bleeding. Do not take this medication frequently with any NSAIDs or acetaminophen, which causes an increased bleeding risk. This drug is also contraindicated during times of infection as it causes mild immunosuppression and can mask side effects. Call your doctor today if you are experiencing these symptoms and think replacement with hydrocortisone may be right for you. Diabetes is a condition in which the body is resistant to or does not produce enough insulin, commonly leading to high blood glucose or hyperglycemia. An individual with hyperglycemia shows signs of increased thirst, urination, and hunger, with fatigue and headaches commonly present as well. Although there are several forms of medication to combat this, insulin, given as frequent injections, is very common. There are several different types of insulin with different peaks and durations of action for when they will produce the sugar-controlling effect in the body. The insulin that works the fastest is known as rapid-acting insulin, with Lispro, also known as Humalog, being the most common. Secondly, we have the short-acting insulin known as Humulin R or regular insulin. An intermediate-acting insulin known as Humulin N comes next. Finally, we have insulin glargine or Lantus, which is the long-acting insulin. The first 3 insulin types are taken with food multiple times throughout the day to help lower the sugar levels that rise with mealtimes. The long-acting insulin, on the other hand, is normally taken once a day at bedtime and is steadily distributed throughout the day. Overall, insulin works by entering the bloodstream and causing the glucose or sugar to be taken up by the liver, muscle, and fat cells as an energy source for later. Since the glucose is taken up into the cells, the amount of sugar in your blood will decrease. Your doctor will be there to help you determine both the types and amounts of insulin administration that is necessary to get your sugar levels under control. Please contact your physician if you experience any side effects of sugar levels that are too low, including becoming diaphoretic, cool, clammy, confused, or slow to respond during insulin therapy. Controlling sugar levels in the body is essential to a safe and happy life. Contact your doctor for further questions about diabetes and insulin today.